It is Tuesday. We're talking health this morning in May, National Stroke Awareness Month. This morning I've got Miss Caitlin Dozier, who's a physical therapist in the hospital, and Miss Malone Gregory, and she's a speech therapist, but she works in outpatient. So two different areas we're going to be talking about this morning. But Caitlin, I'd like to start with you. Whenever we've talked strokes all month long, and we've talked how to recognize them and all this, but when somebody does have a stroke and they come to the hospital, what's the process look like from when they enter the door to when they exit?
Well, you know, you've had people over the past couple weeks come in and talk about once they come into the hospital through the ER and admission onto the heat side. From there, once it's medically advisable, speech therapy, occupational therapy, and physical therapy are consulted to do their assessments and kind of recognize what deficits the patient has at that time. Once the initial assessments are done and the patient is ready from discharge, then it's determined whether they are appropriate for Leflore Rehab, where I work, or as an inpatient stay for an extra week or two just to work on some more deficits so they can safely go home. Or they can also have the option of having a home health agency come into the home and work with them on therapy as well. Or if it's appropriate, go to outpatient where Malone works. And
in order to get evaluated at outpatient, what you would need is a new order from your doctor, and either you can have the patient or the caregiver bring that by our facility, or you can have your doctor fax it directly to our facility at that point, and then we'll get you set up for an appointment to be evaluated there.
And whenever somebody is, when you guys are rehabbing, what are some of the things that you're trying to get those patients to do?
From a physical therapy aspect, we work on their general mobility. How are you going to get from the bed to the chair? How are you going to get from the bed to the bathroom, or from the living room to the kitchen to cook your food? From the occupational standpoint, it's working on, can you bathe yourself, dress yourself, do all these things that you need to do for yourself on a daily basis to go on about your day.
And Malone, let me ask you this: whenever, you know, as a speech therapist, obviously it's a brain injury, and so there's so many different things, motor skills you have to get back. How hard is it for folks who have dealt with stroke to get their speech back? Is it?
Well, it really depends on where in the brain the stroke occurred, and primarily for speech therapy, what we focus on is we can try to rehab language and cognitive deficits. We can also work on swallowing difficulty, and we also work on the clarity of speech, are primarily the biggest aspects of what we try to do in conjunction with working with physical therapists and occupational therapists, just to try to help that patient get the most independence that they can back.
And that lifestyle that they're so accustomed to. And let me ask this one last question this morning. The process of rehab. Rehab is such a big thing, and it can be a long-term thing. How long do you think it takes for a stroke patient? I'm sure every patient's different, but is there a general rule of what they can expect?
There's not a general rule. Like you said, it does depend on the patient and how severe their deficits are from that initial stroke. But really, we encourage for a lifelong process, even after they're done with their outpatient, inpatient, whatever it may be, to continue the things that we've worked on there and continue to progress yourself in your deficits.
In outpatient, what I typically will do is I'll send home a long-term home program at that time of discharge so they can continue to work on things at that point also.
Now, if folks want more information about what you guys do, how can they find out more?
As far as the outpatient rehab,
they can call our number at 662-459-2655, or they can also get on the Greenwood Leflore website.
Okay, fantastic. May is National Stroke Awareness Month, and May 25th coming up this week. It's going to be all-day event at Greenwood Leflore. There are going to be doctors and nurses and PTs and all kinds of folks available to take your questions. It happens at Greenwood Leflore Hospital. If you'd like more information on that, greenwoodleflore.org, right? GLH.org.
GLH.org.
GLH.org. I don't want to mess that one up. Thank you, ladies, for being here this morning. I appreciate it.
Thank you. Thanks for having us.
Stay with us. Coming up, we've got more. Good Morning, Mississippi. We'll be right back.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.